This is ECG exercise number 5, and it's on page 87 of your workbook. And so let's start with the heart rate here. So the heart rate is approximately 70. Now you notice off the bat that we have a bit of an irregular rhythm. So we have an R wave here to this R wave here is equidistant to this one. And then this one happens a little early, and then we have this one, which is equal to this one, equal to that one, equal to that one. So for the most part, the underlying rhythm is fairly regular. So we calculate heart rate based on that area of regular heartbeat. So if I take this QRS complex, the heart rate here is 300, 150, 100, 75, 60. So between 75 and 60 is 15, divided by 3 is divided by 5 is 3 rather, so 60, 63, 66, 69. And keep in mind that this one is just off the baseline, so around 70. Now, you know, if you got 72 or 68, it doesn't matter, especially when the heart rate's in normal range. You know, as long as you're in the ballpark. Where it becomes a little more important to be accurate is when the heart rate is tachycardic or bradycardic. But the heart rate is literally going to change from minute to minute. So, you know, if you got 68, if you got 66 even, or if you got 72, it doesn't matter a whole lot. The P waves are present, but you'll note that one of them has a different morphology. So this one here is a different morphology from all of the other P waves, and that's an important finding. So we'll just keep that in mind. The P interval is 0.16 second. The QRS is less than 0.12 second throughout. The ratio is 1:1 everywhere. The rhythm is regular except where it's disrupted by the ectopic beat or the funny looking beat. So the question is, what is this funny looking beat? So here we have a P wave and a QRS and a P wave and a QRS, P wave, QRS. And you notice these three are equidistant. And then this next one happens prematurely. So this is premature. It has a P wave that's a different morphology from the other ones. So this is what we call a premature atrial complex. The underlying rhythm is sinus, so we say this is a normal sinus rhythm with a heart rate of 70 with 1 PAC. So that's how you would describe that rhythm specifically. If you were looking at the patient overall, you know, what you would want to determine is how often do these PACs occur? Are there 2 per minute? Are there 10 per minute? Are they occasional? Are they frequent? Are they rare? And that's how we might describe them. Now, PACs are generally pretty benign. We generally don't treat premature atrial complexes or even premature junctional complexes for that matter. We just make note of them. You know, like any ectopic beat, we have to question, why are they having ectopics? Is their myocardium irritable? Are they ischemic? Do they have an electrolyte imbalance? Do they have a drug effect? Those kinds of things we start to look for. But otherwise, PACs are pretty benign.